Bismillahirrahmanirrahim. The topic of our discussion today is Wilm's tumor. Wilm's tumor is also known as nephroblastoma, and it is the malignant proliferation of metanephric blastemal cells. Wilm's tumor is the most common pediatric abdominal cancer, and overall it is fourth most common tumors of children. It typically presents in the children less than 5 years of age, and there is a 33% increased risk of Wilm's tumor in children with Weger syndrome. So the pathogenesis involved a mutation of gene known as WT1 gene or Wilm's tumor 1 gene, which is cited on the chromosome 11. So mutation in the Wilm's tumor 1 gene results in the proliferation of metanephric blastemal cells, resulting in the formation of Wilm's tumor. Other genes involved in the Wilm's tumor also include Wilm's tumor 2 gene along with PAX6 gene. The histological picture reveals presence of metanephric blastemal cells, which are small, atypical, and eosinophilic cells. Atypical cells mean they do not classify to be of any specialized category of cells. So these cells resemble the primitive population of the cells known as metanephric blastemal cells. The tumor might also have some stromal cells along with the tubular epithelial cells, which could be cuboidal or they could be columnar, and there is also presence of primitive glomeruli. The Wilm's tumor, which reveals the presence of epithelial cells, stromal cells, and blastemal cells, are typically known as triphasic tumors. Mitotic bodies are abundantly present, and there could be also presence of focal necrotic areas. The children typically present with the flank mass, which is large, palpable, and mostly unilateral. So the flank mass is present in almost 80% of the cases with Wilm's tumor. There could be a history of abdominal pain and hematuria, which are present in almost 25% of the cases of Wilm's tumor. There could be hypertension, and the tumor typically occurs in the children less than 5 years of age. The diagnosis is established on histopathology and radiological imaging to establish the full extent of the disease. The treatment is mostly radical nephrectomy. If you have any questions, do let us know in the comment section. Thank you.